Hi, everyone. This is our first grand rounds for child and adolescent psychiatry um, of our 2024 to 2025 academic year. Welcome. We have a new requirement this year. Dr. State, our department chair, has asked that faculty please attend grand rounds, at least 50% of grand rounds. And so we should have a sign up sheet to mark your attendance outside along with some lunch. So please help yourself to lunch and please be sure to sign in so you get that credit for attending in person. And so great to see you guys here. My name is Chuan Mei Lee. I'm an associate professor here in the department. I'm a child and adolescent psychiatrist, and I am the associate chair of our Grand Rounds Committee. I am here on behalf of Barbara Stewart. Dr. Stewart couldn't make it today. And so I have the privilege of introducing our inaugural speaker for our Grand Rounds year. So Dr. Holloway is a UCSF Department of Psychiatry assistant professor and licensed clinical psychologist. He has 15 years of experience in research at the intersection of forensics, child and adolescent psychology, developmental psychopathology, and public health. He has advanced clinical and research training in pediatric and forensic psychology, substance use treatment, and services research. He conducts research in the Juvenile and Justice Behavioral Health Lab at ZSFGH, focusing on improving behavioral health and legal outcomes for youth and families involved in the legal and foster care systems, and service access for publicly insured youth. He is a consulting psychologist for the California Mental Health Access Program, CalMAP, and he provides clinical supervision through the Multicultural Clinical Training Program at ZSFGH, as well as research supervision through the Clinical Psychology Training Program and Juvenile and Justice Behavioral Health Lab. So please, let's welcome Dr. Holloway for our first grand rounds of the season.
Thank you, Chuan Mei, and thanks everybody for coming today. Welcome. It's exciting to get this year started, but welcome especially to all the new trainees. Welcome to UCSF, and thanks y'all for coming. I don't know if you got the memo, but today is also a very elaborate exposure for public speaking that you're all a part of. So surprise, welcome. Thanks for your participation. I should say today, the title of my talk is Rehabilitation Realities and the Impact of the Juvenile Injustice System on Behavioral Health and Legal Outcomes. It's a topic that I have been, I think, a lot about, been sort of immersed in for the last, 17 years or so. And so appreciate the opportunity to share some of my thoughts and some of my work. So I want to start by acknowledging that this is the traditional unceded land of the Ohlone Ramaytush people. And I have no disclosures related to this presentation. All opinions are my own. So I want to give, this may be like a little millennial, but I want to give a little content warning. For everybody today, we're going to talk about primarily established research findings and some sort of novice policy analysis related to the juvenile legal system's ability to achieve its stated goals, which is rehabilitation of those who have gotten in trouble with the law or committed rule-breaking behavior that could harm society. We'll also talk about the future prevention of youth who could engage in such behavior. However, there are several sobering and potentially disturbing topics that we'll cover today, including a case study of racist police violence towards children. So, to share a little bit about myself, as I said, I've been thinking about and engaging in this work for close to 20 years, and I've been blessed and burdened by several stories that have been shared with me from youth that I've worked with and also research participants. And so those voices and experiences really inform all of this work, and I would not be here without without those lessons. So I just wanted to acknowledge that as well. So starting off my positionality, I'm a biracial, white, Japanese, cis man, neurodivergent. I have some lived experience related to this topic. So growing up, I wouldn't say I got into a lot of trouble at school, but more than most of my friends. So that included like 7th grade, I got in-school suspension because I got in a fight. Some kid tackled me because we were playing basketball. I got in trouble. In high school, went to a huge high school. We had to run from one corner of the building to the other in 7 minutes, like literally sprinting. And so I almost got suspended because I had 7 tardies in one semester. And one more, I would have been suspended. Every time I was late, I got sent to the holding cell. That's what we called it at North Central High School in Indianapolis. And I mentioned that because that is a common pathway where kids can get involved in the legal system. Is first, they can get in trouble at school. Had my first police contact at age 8. And then between 15 and 19, I had several interactions with the police, as well as being in handcuffs, participating in diversion programs. And then there was an event when I was 21 where the same police officer had an interaction with 2 of my siblings on the same day, 2 different incidents. And that had a huge impact on sort of the trajectory of my family and specifically my siblings. But this is me, one of the siblings from the incident that day is my little sister, Dr. Olivia Holloway. And that was about junior year of high school. So the objectives of today's talk are to understand the contemporary and historical tension between rehabilitation and punishment in the United States juvenile legal system. We'll review evidence for how effective the legal system is, functioning as a behavioral health service delivery system for youth who are involved. And then we'll talk about 3 different types of rehabilitative reforms. It's actually a couple more, but really 3 types of reforms and how those impact youth overall, but specifically ethno-racial minoritized youth. And then finally, we'll think about, based on everything we know about how rehabilitative the system is or what sort of that potential is, different pathways that you might consider or that I've considered and colleagues have considered in terms of how to engage in clinical research and implementation science. So I'm going to go through this really quickly because I'm preaching to the choir here. But for a primer, because I know we might have some non-child adolescent folks coming to Grand Rounds today to get your attendance. Yay. So we're going to cover this. So adolescence broadly ranges from like age 10 to age 25. And every kid is different, right? Some might be a little earlier, a little later. But broadly, 10 to 25 is the range we're talking about. Adolescence is awesome. This is like the transition to adulthood, but it's defined by near constant change. You could not pay me to go back to being like 11 to 14. I think middle schoolers, they go through a lot, right? So that means increasing independence, more risk-taking and sensation-seeking, as well as several stages of identity formation. And I just want to acknowledge that these changes are all normal, adaptive, and appropriate to prepare for adulthood. Again, really briefly, so there's adolescence, and then broadly, within adolescence, there's sort of these different stages. And I want to highlight a couple of key factors here. Early adolescence, peers become increasingly important. This continues into middle adolescence, might spend a little bit less time with their family, more time with friends. And in sort of late adolescence, you might live independently. Legally is where you start to be treated like an adult. And depending on the state statutes, you might be treated like an adult for your behavior even earlier. All right, so how does adolescence relate to rule-breaking behavior and getting involved in the legal system? This graph kind of highlights the trajectory of risk in adolescence, starting at age 10, sort of spikes, and we can see that there's a spike in risky, sort of more impulsive behavior around like 14 to 17. And this is driven by this balance between a more developed reward system, right? And that imbalance with like a less slower to develop regulation system, ability to regulate some of those impulses. Let's see, so I just want to highlight again that this is pretty normal, and it's been described by Steinberg and colleagues as like starting an engine without yet being a skilled driver. So as this relates to kids, kind of who the population I've been interested in, kids who get involved in the legal system or those who are at risk, want to highlight Terry Moffat's work, which was really seminal in this area. So this graph shows there's several different trajectories of rule-breaking behavior. These are all conduct disorder symptoms. Conduct disorder is defined by behavior that sort of against the law or can get you in trouble with the law. And I was given this awesome little tool. There we go. So I want you to highlight these two trajectories and kind of work backwards, right? These two, but between 21 and 26, this is where we still see some persistent conduct disorder, kind of rule-breaking behavior. And if you trace backwards, one of those groups starts pretty high. That's what's been described as this life course persistent group, where there's a much higher rate of rule-breaking behavior starting even around age 7. And that stays pretty consistent. And then the other group starts sort of low and increases over time. And again, every kid is different. So I don't want to put anybody into a box, but broadly, I think this is helpful to understand different trajectories. The adolescent subtype can be driven more by peer influence, modeling of certain behaviors, that gap in sort of maturity, reward, and the reward system I just talked about, and some evidence suggesting that rule-breaking behavior around this age is actually a way of enforcing and sort of showing your autonomy, right? I can make my own decisions. I remember being 15, I had a job, saving money to buy a car, didn't feel like a little kid. I'm not a little kid anymore, but I'm also clearly not an adult. So this life course persistent trajectory is more driven by, there might be some genetic risk as well as other physiological markers. But the take home from this slide I want you to have is that most kids break rules and most of them will grow out of it. And so what that means is, in terms of for rehabilitation, is that the best thing generally for most kids is to do little to nothing at all. Okay. Does anybody listen to the podcast, Kids of Rutherford County? Okay. Yeah, there's a snippet. It starts with this incident describing a group of Black kids around between ages 8 and 11 who are arrested for appearing in a video where they're encouraging 2 kids to fight, like playing basketball. One kid shoves another kid. And then the rest of the podcast, you should really listen to the whole thing. The rest of the podcast gets into the way the court works and really these more structural factors that drive these types of incidents. But I thought it was important to kind of give this as an example, because as I was listening to this, I heard this one quote here about the juvenile court's function being to rehabilitate. So I thought it was really important to listen to a little snippet here. Oh, wait, how do I? Oh, there we go.
Where you think the beginning's at?
Well, as my report says, on 4/13 at approximately 10 o'clock, a teacher showed me a video.
Officer Templeton declined to speak with me, but she spoke to internal affairs investigators for almost 7 hours. And in those interviews, she talked about what she saw when she first watched the video of the fight.
The group's pushing these 2 little kids to assault this other child. It was the whole group, and they're basically all doing the same thing. At some point, someone could have went and got an adult. I'm not saying jump in and physically stop the fight, but they could have went and got an adult. No one did anything.
So you felt obligated to try and arrest as many of those kids as possible?
I did not feel obligated at that point to arrest anyone. I felt obligated to investigate it if the detective division wasn't going to.
Okay.
For much of this interview, the tone of Craig Snyder, the lead investigator, is what I describe as perplexed over how arrests this unusual could happen in the first place. But to Officer Templeton, she seems to think the arrests were all pretty straightforward. In her view, she was just doing her job.
There's an assault here. There's a victim here. Juvenile court is about rehabilitation. And I felt like I needed to do something to help these kids. If I can get them in front of the judge, maybe she can put some services in the home, I don't know, whatever. It's about rehabilitation.
Did anybody at any point, any supervisor, Did any of them at any point tell you, no, you're not going to do this?
No, no one ever said,
Stop there. So what ended up happening is this police officer saw this video and then told an 11-year-old and her mom, I'm not really going to do anything. I just want to learn more about what happened, coerced the 11-year-old into giving names of all the children present. It ended up with 11 kids getting arrested who were booked. Half of them, all boys, spent at least one night in jail and some for the weekend. I just thought it was really stark to see how criminalization of normal child behavior can be framed, and I think she's telling the truth, as a reason to rehabilitate, right? But I don't want you to think that this is something that only happens in Murfreesboro, Tennessee, something that happens across the country. Right. There we go. Okay. Okay, so this is from 2023. It's the rate of children in detention per 100,000. You can see America first and Canada. We lock up more kids in North America than anywhere else in the world. And that's about 126 kids per 100,000. It's almost double the nearest region. So basically, you can see this is an example of how this kind of thing happens. I think I like history. I think it's important to think about where these types of systems come from. And so I read a really fun article by some historians noting that these changes sort of started all the way back in like the 1800s in sort of Western societies, including in like 1810s. There was an age established in France that being under 16 and having some discernment meant that you were less culpable and that we needed to do something to correct their education. This continued in Western Europe and England into the 1820s, realizing when we lock kids up, we shouldn't keep them with adults, right? And sort of this is one of the earliest times that I saw where they are recognizing that there's an influence from older people in terms of modeling negative behavior. In the last 25 years of the 19th century, we start to see some of the origins of the juvenile legal system in the United States. And our current system is very structurally similar to how this first juvenile court in Chicago was established in 1899. This movement was led by high society women who saw that there was an influx in poor, largely immigrant populations in city centers who needed to be protected and identifying those who could be salvaged. And many were also involved in children's aid movements, which ended up sort of morphing into what our current juvenile probation system is today. So I think it's really important to think about how this mentality is very similar to like, we need to manage the rehabilitation of children, and also correctly recognizing there's a lot of social and structural drivers of behavior and behavioral health. So this brings us to the 1900s to today. Four sort of major areas of the eras of the juvenile legal system. Right after this juvenile court was established, there's the parents patriae, I don't know how to say that, era. And this was explicitly like, hey, these kids, your family's not doing a good enough job. We're the court, we can do a better job. So we need to step in and sort of protect you and protect society. It was subjected to many biases, as it still is today. And this was really marked by a lack of due process. So even the terms that we use in the legal system, like we don't convict a kid, we adjudicate them delinquent. That all comes from this origin of like, we need to treat kids differently. That also meant there was a lack of due process. So a lot of those protections afforded to adults were not extended to children. In the 1960s, there were a couple of Supreme Court decisions that implemented some of those due process protections and also recognized the failures of rehabilitative models as it had existed for the last 60 years. It continued, though, that many children were being removed from their homes and from their neighborhoods, being placed in reformatories or sort of correctional schools. In the 1980s, we enter the Get Tough era. This is driven by political belief and a real increase in crime across the country. Youth had been described as super predators, and this led to policies that increased secure confinement in this country. In the 2000s, there was more and more neuroscience research, more adolescent behavior and neuroscience research, and some amici briefs submitted to the Supreme Court did have an impact. We're going to get into some of those, but we started to see a reduction in secure confinement during this era. So with that sort of backdrop, there's always been this tension historically between rehabilitation and community safety, and that the legal system, the juvenile legal system's job is to sort of manage this, both at the group level, right, and keeping everybody safe, but also to prioritize this youth. And in the late 1940s and sort of early 1950s, started to see some scholarship from frontline staff working in like probation and courts, as well as scholars sort of grappling with like, well, what does the court do? How are we supposed to support this? And you can see there's a big focus on like casework, right, which is another way of describing sort of social work or getting people connected to the right types of services. But broadly, everybody sort of landed on what makes us different from the adult system is rehabilitation. That's our purpose. So what are we rehabilitating? I want to go over some facts of sort of our present day system. So we know youth involved in the legal system experience much higher rates of mental health problems than their non-involved peers. Adolescents generally are unlikely to seek care on their own. It's usually an adult who knows them recognizes there's some sort of help that they might benefit from, and then help get them connected. In this country, juvenile probation officers have sort of been assumed that role in rehabilitating, right? As being that adult when kids get involved in the system, who help identify treatment needs, get them connected to care. They've both been identified by youth involved in the legal system, and this is also statutorily a thing probation officers are supposed to do in many states. I want to focus specifically on substance use because it is one of the few, it is not one of the few, but it is a primary driver of legal involvement and recidivism in the United States. So substance use is elevated among youth involved in the legal system, with over half reporting using one or more substances in the past year. And you can see that these rates are increasing. This is from 2002 to 2017 graph showing that it's increasing pretty substantially, from between 50 and 60% for youth involved in the legal system compared to those who have never been arrested. These youth are 5 times more likely to use cannabis than their non-involved peers. And despite knowing all this, substance use prevention for youth involved in the legal system is very rare. And so despite being sort of in this, 20 years into this developmental era, focusing more on rehabilitation and that children are different, and overwhelming epidemiological evidence that there's a very high behavioral health burden, we still are much more reactive than preventive. This is a problem. Even whenever there are, though kids do get into treatment, they usually don't benefit, they don't access, right, or sort of stay engaged and benefit to that to the extent that we might hope that they would. Okay. So the reality is the juvenile legal system is sort of the de facto behavioral health provider or connector for youth in this country. Let's take a look at how well that works. Again, we're going to stay focused on substance use. It's this model called like the cascade of care. I want to bring your attention to the far left. And we're going to kind of go from left to right. And so you can see this is if the way that you would systematically identify kids coming into the legal system with like substance use problems, for example, is to have universal screening. There's a lot of evidence to support this. Whenever screening does occur, we know that many of those kids actually don't get referred. There's no further steps. So if you think like about 70% of kids actually get screened for substance use, about 50% are identified as actually in need. Follow this to the right, even fewer kids are referred to treatment, fewer initiate, meaning they make it to one appointment, even fewer stay engaged in treatment, and very few, like less than 3%, stay in care. Maybe sometimes they don't need to stay in care, right? We're going to talk about like this assumption that kids always need more, which is often incorrect. But you can see that our system is not working very well in terms of identifying substance use problems and getting kids help for that, for example. All right, this want to give like a very brief sort of review of how the service delivery system is supposed to work for some criminogenic need areas. These are empirically identified like through meta-analyses, treatment targets or modifiable environmental characteristics that are associated with recidivism and more delinquent behavior. So they include education, employment, family, substance use. You can read all the way down. So whenever a need is identified through a systematic process like screening or assessment, that means that you should get treatment for that, right? So like if I break my ankle, the treatment would be like, go get an x-ray, actually did break my foot recently, get an x-ray, get a boot, right? So if I went to go get like a dental cleaning, that's not gonna fix my ankle. So if we are identifying problems with substance use, personality, for example, and then we're actually referring kids to treatment for those, we do see reductions in recidivism. So that's that orange box. So that's a good thing, right? Whenever these sort of models are implemented in the real world, then we do see some benefits. This graph takes the sort of match rate. So it sort of like the percentage of needs identified versus those that you actually get help for, right? And we can see that youth who have a high match rate, that is, they're getting help for most of the needs identified, they have a lower risk of recidivism, specifically, and then kids who don't in this low match group, they are much more likely to recidivate, right? Specifically, kids in the low needs match group were 18 times more likely to reoffend or to have a new charge than kids in the high match group. And there was a difference between the moderate and high match group as well. So the thing you should take away from this is whenever we are able to actually identify treatment needs and we get them connected, we see improvement. But when we don't have that match, we actually can cause more problems, especially for kids who are at low risk, which is most of the kids who come into contact with the legal system. I want to present now a little bit some of my research on how probation officers going through this process, identifying treatment needs, specifically trauma, how they deal with that on a case plan. So that's like, I identify a need, now where am I referring you? So I did a vignette study to see how probation officers dealt with trauma, so information about exposure to traumatic events and stress symptoms, and then how they scored a risk needs assessment instrument, and what they did with that. And so we found that, here we go. So basically found that about half, a little over half of probation officers were able to identify, hey, this is a traumatic event, great. And hey, this looks like it could be a related trauma symptom. So they were able to identify that in these vignettes that we had them read. You can see to the right, about 2% or fewer actually made a referral for trauma-related services, for example, right? So good, we're able to identify, screen, but then when we look at what they actually do with that, they're basically ignoring trauma. And this is a population where there's a very high rate of trauma exposure and post-traumatic stress symptoms, which is exacerbated by being detained or incarcerated. Now, it's possible this wouldn't apply in the real world. This was a vignette study, right? But there were several other treatment needs that they did identify, so I think they were actually pretty engaged. All right, now we're going to talk about some reforms to this system. The first are US Supreme Court sort of decisions, right? And I don't know how I think about reform, how you think about reform, but trying to think about sort of what came after several of these decisions and how that influenced outcomes. All right, so in the 1960s, I talked about this already. There were two decisions, Kent v. United States and re Galt, that expanded due process protections that were typically found in adult courts to juvenile proceedings. And so I'm kind of describing those as like the due process cases. And then to the right, we have some other cases that focus on reduced culpability. So this is acknowledging like 2005 to 2016. You can see the impact of science, of adolescent developmental research on the legal system. And so these really focused on, recognizing that adolescents have reduced culpability for really heinous crimes, very violent crimes, So specifically banning the death penalty for youth younger than 18 and mandatory life without parole for all crimes except for homicide. And a couple other cases where they like retroactively applied this to people who had previously been sentenced to life without parole or death sentences. And so these have worked sort of in concert with some federal legislation that's been driving change or not in the legal system over the last 50 years. So I want to talk about the primary federal legislation in this country, which is the Juvenile Justice and Delinquency Prevention Act. This was first passed in 1972 with the goal, it's the name, right, to prevent delinquency and improve the way the juvenile justice system works. You may notice that I describe it as the juvenile legal system because research shows very few people who are identified as potential perpetrators and victims or survivors feel that they are experiencing just processes. But this is what the legislation is called, so I'm referring to that here. So it's been modified or reauthorized several times, most recently in 2018, and it has really 4 core aims, which is to deinstitutionalize status offenses. Anybody know what a status offense is? Well, I know some people. These are things that kids get in trouble with in the law that adults wouldn't. So only because of their age, right? So things like being a public nuisance, that used to see legislation saying incorrigibility, right? Things like that, running away from home. So basically, one of those core things this legislation prescribed was you can't lock kids up for running away from home, right? You can't lock kids up for being out past curfew. Great. Another was separating youth from adults in secure facilities, and then also removing youth from adult jails. You can't lock a kid up in an adult jail. So those were some of the primary foci. In 1988, we see this 4th mandate, which is that you need to address disproportionate minority confinement, right? Initially it was confinement, then it was modified to be contact. So that was introduced in 1998 and then became contact in 2002. So this is great, but I think the question we should all be asking is like, some of these are easier to operationalize than others, right? And addressing isn't super clear. So let's look at how the JJDPA impacted overall delinquency cases and convictions since it was authorized in 1972. So it doesn't go all the way back to 1972, but starting in the 1980s, you can see that there is a rise in overall caseload, right, from like 85 to the mid to late 90s, where we're approaching 2 million cases across this country. It's huge. And then there's sort of a steady decline into the early 2000s. And since then, there's been a decrease in delinquency cases, which is great. And we still lead the world, right? In detention, for example. And this pattern holds true for those that are adjudicated delinquent. So there were like about 2 million cases at its peak where they're for delinquency. And these are those who are like convicted, right? And then usually that can mean like detention or placement, maybe removal from the home. And so you see this sort of similar pattern over time. So is that due to federal legislation? Maybe. And some of those Supreme Court cases? Maybe, probably some. So with those reforms, I think it's great. We can say fewer kids getting in contact with the law, good. Fewer kids getting detained, even better. It's important to think about how we disaggregate the impact on minoritized youth, especially Black youth in this country. And so you can see this is from 2005 to 2019. You can look at every type of crime, so person crimes, property crimes, drug crimes, and public order crimes. You can see that while the number of cases has decreased overall, those benefits have not been extended to Black youth specifically. So just want to highlight this. We've had some reform, we've had some reductions, yet in a way, these reforms have exacerbated and furthered some of the systemic racism that has been inherent in this system from the beginning. And this is from 2024, looking at other types, sort of different decision points, right? We know every kid who, not every kid gets arrested, but you have to get arrested before you can kind of go further into the system. So you can see that Black youth are over two times more likely to be arrested as white youth. They're more likely to have they're less likely, sorry, to have their cases diverted compared to white youth, which means like, hey, it's your first time, you got in trouble, and actually you don't need to go to, we're not gonna take you to detention, right? And sometimes there's formal programs, sometimes this happens more informally. Black youth are 60% more likely to be detained than white youth, and they're more likely to be committed to a incarceration facility than white youth. So we're really seeing this at like every level of the system. So let's look at, I mean, this is my opinion, curious what you all think, but how effective has this legislation been? Did it reduce delinquency? It's unclear. We see a decrease, right, in like the 2000s. But at the same time, there's been an overall trend in reduced crime across the country, right, since the early 1990s. Despite people, including in this great city, saying that they feel like it's more dangerous, the data does not back that up. And so you can see to the right, this is from 1993 to 2022. There's been a decrease in violent crimes overall, and for those 12 and up, as well as for property crimes. So has this sort of legislation and the Supreme Court decisions, has it improved the system? Maybe for white kids, but ethno-racial minoritized youth are still treated the worst, even though research shows unequivocally they're not more likely to engage in delinquency. So I want to be very clear about that. Okay. The next type of reform we're going to look at is state legislation. So there's two examples we're going to look at. They're both focused broadly on rehabilitation, one on behavioral health screening and another on institutionalization in California. So in Indiana, my home state, there was some legislation passed in like the late 2000s, early 2010s, saying that mental health screening at intake to detention was mandated, which is good. We would support that. And I think the hope was, well, if we're screening everywhere, we're screening every kid, hopefully, then we are going to be able to identify those who have behavioral health needs at a greater rate, and then they're going to get into treatment. That's what's going to happen. We just need to screen. If we find them, we can get them connected. And unfortunately, this study found that it did not improve connection to care. So attending one mental health visit 30 days post-release from detention, and went from 14% before this legislation passed to 16%. And 60 days post-release, we see the same pattern. It only increased the rate of attending one appointment, which is like the modal number of appointments people attend, by 2%. And this held across age groups, as you can see there in the blue. So that's pretty disappointing. The other legislation is much more recent, which is the Department of Juvenile Justice realignment here in California. This was implemented by, Senate Bill 823 here in California. The purpose was to close state incarceration facilities where there's a low census, it's really expensive, and also there's sort of this focus on, we want to shift this focus to local counties where kids are going to be closer to home, they can rebuild relationships with their families, this will facilitate their reintegration back into their communities and society. So some of the main impacts of this legislation means that those kids are going to be released and outside of the juvenile legal system at age 25. And it established this Office of Youth and Community Restoration. The office, the OYCR, I took this from their website, they describe this legislation, it marks a shift in California's approach to young people who commit law violations from a punitive approach to an approach centered on health and healing. I think we can all agree with that, right? And OYCR's responsibilities has 4 of them, but the one I highlighted here is really key, which is that they're responsible for identifying and disseminating best practices to help inform rehabilitative and restorative youth practices. And so as I showed a few slides ago, right, we know theoretically, we know how we could do this to implement some best practices. However, there's not a lot of scholarship on this, but I wanted to highlight some reasons why we need to be really thoughtful about how this is implemented. This is data from 2019, the year before this legislation passed. And on the left, you can see this is the youth population, age 14 to 17, about 2 million kids in California, or 52% identified as Latino, 6% Black, 28% white. And then if you move to the right, you can see the 345 youth who were committed to the Department of Juvenile Justice. And there are 36% of those kids who are committed are Black, right, compared to 6% of the population. So this in 2019 is still a vast overrepresentation of Black youth who are receiving these sort of most severe sanctions that we know cause harm. To the right is adult court transfers. And this means like, hey, you did something so bad, we're not going to treat you like a kid, you need to be moved to adult court. And so again, you can see that Black youth are overrepresented here, as are Latino youth. And so unless we do something fundamentally different, right, with this new DJJ realignment, it is very likely that some of these racial disparities will persist. This sort of is a different way to look at that data. So compared to white youth, those who were, Black youth were 31 times more likely to be committed to DJJ. Latino youth were 4.9 times more likely to be committed to DJJ. And so just put this out there because it's something we need to be aware of and think about. How is this legislation actually being implemented? So I was curious to see like, hey, how has this impacted how many kids are actually in detention under this new DJJ realignment? Love a dashboard. So I took a look to see the number of kids who are currently incarcerated under this, this legislation. So these are all, SYTF stands for Secure Youth Treatment Facility. And that's describing these kids who have been moved from the state facilities to the county. And so you can see in 2022, there were 326 kids just sort of described within this population, and that is increasing steadily. So I guess we're going to see, we're going to see what happens, but it looks like these numbers are sort of increasing so far, which is not encouraging. Some of the things to consider with this DJJ realignment is that this legislation does not mandate specific evidence-based practices or programs, which we know is a challenge to implementation, right? Taking what we know from research and putting it into the real world. And implementation is left up to county probation offices' discretion. Other research shows that even if you are doing an evidence-based practice, but there's poor implementation, this can actually cause harm, and at minimum is just ineffective. I found a policy analysis here from Patrick 2021 that looked at how much it costs to actually support developing these rehabilitative programs at the local county level. And they concluded that many counties are underfunded and likely understaffed. However, there has been plenty of money that's being spent on building new facilities and new units. So I think we'll see like where the money is being spent, right? There's also another barrier to this legislation success, I think, is political pressure to be tough on crime and pro-community safety. This is not an endorsement of any politician, but like I just read this article about Pamela Price in the East Bay, who is facing recall because she explicitly wanted to partner with community-based prevention organizations and take a less punitive approach, right? So people who are explicit sometimes about wanting to be more rehabilitative, less punishment oriented, do pay the price politically. All right, so now we've looked at these reforms, we looked at the system. This has informed kind of a few different ways you might think about engaging with these systems to do research, working with the system and working around the system. So I'm going to focus on some research that I've done both in Indiana and then some that I'm engaging in right now. So one of the things I was interested in when I realized like probation officers play such a huge role as this gateway provider to care is how do they do their job? And the way that they identify, they think about themselves even as like more as a cop versus more of a social worker. that can influence how they do their job, for example. One of the things I was thinking about in the literature sort of suggested was, well, if there's like a complex mental health situation, they're not really trained as clinicians. Some get like social work degrees, for example, but how do they deal with that, right? So I wanted to look at several different factors that were associated with their use of different strategies: deterrence-based strategies, restorative justice, and treatment-oriented strategies. The treatment-oriented ones are the ones that I was really interested in terms of service delivery. So we found that probation officers who felt like they were more capable of dealing with complex mental health situations were more likely to use treatment-oriented strategies, which is great. The other interesting thing, we looked at this data from 20 counties within the same state in the Midwest, was that between a third and half of the variance explained in which strategies they used just depended on what county they were in. So a lot of this variation, even within one state, is just based on sort of structural factors, cultural factors within probation departments. So I thought that that was pretty interesting. Also was curious to see how probation officers, given all of the disparities, I haven't even gotten into how sexual and gender minoritized youth are treated, because that's like a whole other talk, but we wanted to look at these different factors and how probation officers might make different types of recommendations for kids based on different characteristics. So we use conjoint analysis to systematically change some of the characteristics. This is an example to see sort of what types of recommendations they would make. So example vignette was, you have a 16-year-old female who's been arrested for running away, status offense. She's screened positive for mental health problems. Her family has not participated in the probation process in the past. And we found that, so these are placement recommendations. And so we found that they paid a lot of attention to the offense. 48 important scores, like 49% is what their offense was, right? And secondary to that was mental health screening, whether or not they recommended that they go to prison or that they stay in the community. Also looked at whether they recommended like no intervention on probation, right? Like, I'm not going to talk to you that much, and maybe don't wear an ankle monitor, things like that, versus more intensive probation. And we found that there were some ethno-racial differences. So if a kid was Black, they focused more on the mental health screening if they had screened positive for mental health problems. So there's kind of a misalignment, right? Of like, oh, you're having mental health problems, so I think you actually need more intensive probation and restrictions. We also saw that gender was really important, especially for Black girls. And so Black girls who were much more likely to be recommended for intensive probation. The offense was the most important thing for white kids only, not for Black kids, right? So whether or not they'd done a status offense, which isn't really a crime, and if they had engaged in a crime like burglary, they were more likely to refer kids white kids who had engaged in a burglary to intensive probation, and it didn't really matter for Black kids. And then we looked at mental health service recommendations. And so recommending more intensive home-based services. This was more likely for Black kids than white kids. But what was most important for Black kids in the sample was the offense, right? So engaging in burglary versus running away, they were more likely to get mental health service recommendations. So you can see where there's like this mismatch of things that are driving probation officers' behavior. So it's an example of some research that I've done within the system. Now I want to focus more on some current research I'm engaged in to think about how we can improve outcomes for kids involved in the legal system outside of working through the courts or the sort of traditional system as it's been built. And so I have a K-23 that just got started, funded by NIDA. And the focus really is, can we look at preventing upstream from legal contact, poor legal outcomes and behavioral health outcomes? So focusing on kids who have gotten in trouble at school and kids who have started to use cannabis. So working with a community-based organization who is embedded within local schools to try to develop an ecological momentary intervention for kids so that they can be empowered to change their behavior around cannabis use, for example, and to hopefully prevent worse legal outcomes. And so expanded this to be not just like kids on probation, but kids who've ever gotten in trouble at school. And I think I'm short on time, so I'm going to skip through some of this stuff. Okay, so some of the conclusions and future directions. Again, we'll go through this very quickly. Despite several areas of reform, the system remains iatrogenic, and that it does cause more problems for a lot of kids. Future direction is to think about how we can reduce the scope of the system's responsibilities. I think, frankly, there are certain things that folks are asked to do who work within these systems that they don't want to do, might not be trained to do, or empowered to do. Reaction is still the rule, and prevention is an afterthought. So we need more prevention. Systemic racism is clearly at play, and the reform that has been enacted benefits some, mainly white and upper class kids, way more than others, those who have been historically and contemporarily oppressed. So all reform efforts really need to start with an anti-racist framework and then consider intersections with other forms of oppression. We also need to consider how our fields and our practices, even unintentionally, support policing and sanctioning of youth and families that we serve, especially if they support this system's ability to sort of function well enough, right? And so it's important to be creative about who we're partnering with, making sure that we're centering and empowering people with lived experiences and listening to them. And also partnering not just with system partners, but also folks working in like health sector, and community-based organizations. So some other recommendations for everybody, because I know not everybody here works with kids in the legal system, but you probably will at some point if you haven't already. So stay curious and really question about, the types of practices that you are doing or stuff that we just do in our clinic or we do in, within this field, if it's actually supporting rehabilitation or causing harm. And as clinicians, wherever possible, do what you can to steer clear your clients clear of the legal and child welfare systems, because I'm not saying no one has gotten support, right? There is, but at a population level, we know often involvement in those systems can cause more problems than they help solve. And then we really need to be aware of our role. I said psychology because I'm a psychologist, but psychology and behavioral health systems' role in contributing to the development and sustainment of oppressive and harmful systems. So quick gratitude, all the families and youth who have shared their experiences with me and participated in research. My family, shout out to Charmaine Scott, who's a social worker who first trained me like a while ago, who still informs a lot of the work that I do, and to the department, as well as the National Institute of Drug Abuse, the T32 program, clinical psychology training program, and then finally, my lab, Juvenile Justice Behavioral Health Lab. So thanks, y'all.
Thank you so much, Dr. Holloway, for such a wonderful talk. Now we'll have some time for Q&A. I can pass the mic to someone in the audience who has a question. And then we're also monitoring the Zoom chat as well.
That's cool too. Okay.
I was just curious if there are any representative models within the Bay Area or other places that you've worked that kind of, highlight a different way of doing this kind of work that where you're seeing actually more effective outcomes.
Yeah, thank you for that. There are a lot of great examples. I think when I was thinking about like what reforms to highlight, there were several other things that I wanted to think of that were like more local. So we do see more sort of successful approaches, and they're very localized, right? And so I think that's great. But then the question is, how do we increase that, right? And sort of scale that is the word I'm looking for, and implement that in other places. The reforms that I highlighted today are largely driven by like incentives, right? So like in the Juvenile Justice Delinquency Prevention Act, it's like, if you meet these goals, we're going to give you more money. If you don't, we're going to take it, which I think is interesting because they think that'll work for the system. But then I shouldn't say they, but like often things like contingency management are not allowed, right, to incentivize behavior for children. So I think we need to think about like how to scale those really great examples, and to understand more about how we can really change system behavior and set them up for success. Thank you.
Questions from the chat? So this is a question from Kelly, who thanks you so much for a great presentation. The research about treatment match affecting recidivism really resonated in her internship in the juvenile probation system, a long-term secure treatment facility. They were directed per probation to not provide trauma-focused treatment to youth, to incarcerated youth with trauma. Instead, they were trained to prioritize behavioral interventions to try to address criminal offending and reduce criminogenic risks. I'm trying to see. Curious if you have done or found research on which trauma treatments are actually effective within the secure setting, or if the setting is fundamentally incompatible with such intervention.
Thanks for that, Kelly. That sounds about right. Trauma is something that needs to be addressed because it impacts, well, one's well-being, which should be enough, but it also impacts the treatment of those other criminogenic needs. So I would say there are the same treatment models that we know work for kids in general, also can work for youth, but I think it's obviously going to be limited in scope when you're in an environment like a locked facility, right, where you are exposed to higher rates of trauma ongoing. And also there's a lot of other things that could interfere with treatment, right, like privacy, the ability to use skills that you're learning and practicing, and also just like a more like triggering environment. So I don't know that those are super compatible, and a reason to keep thinking about deinstitutionalization as a goal.
Well, we'll give a loud round of applause to Dr. Holloway. Thank you so much for this wonderful grand round. And we'll see you guys next time. Our grand rounds are now moved to once a month, every second Wednesday of the month at noon. See you then. Please make sure to use the sign-in sheet on the credenza on your way out if you have not done so already. Thank you so much. Have a great rest of your day. Okay, bye.